Okay, this is PAILs and rails for hip external rotation. In other words, your ability to do this or this. So the most common way to train hip external rotation is from our 90-90 position. And our setup here is we're trying to establish a 90-degree angle in this front leg and a 90-degree angle in the back leg. If you can sit comfortably in this position, this is where you'll start. So your front leg right now is in external hip rotation. So this is going to be the leg we'll be focusing on. You're going to square up your hips. Hands are going to be at either side of your front leg. You're going to sit up nice and tall, and you're going to lead with your chest, bringing your belly button as far forward as possible. And what you're trying to do is you're trying to look for the stretch in the outer part of the hip. Now, if you can't feel the stretch in this position, what you can do is take your pelvis and tip the pelvis forward, going into an anterior pelvic tilt. So imagine your pelvis is a bowl. You're going to tilt the bowl forward. So you find that stretch and you tilt, and that should help to increase the stretch. From here, you're going to hold this stretch for 90 seconds to 2 minutes. After your 2-minute stretch, you're gonna go into your PAILs contraction. So in order to do that, what we're going to do is we're going to drive this foot down into the floor, being mindful not to let this knee pop off the floor. So from here, you're going to make this foot heavy into the ground. You're going to do this contraction gradually, starting at 20% of your effort and going all the way up to 100 or whatever your safest maximum effort is. We go into the ground 20%, then 40, then 60, slowly ramping up, 80, and then 100%, as hard as you can, keeping that pelvis tilted forward. Don't lose the stretch. You're gonna hold this tension for 10 seconds. After 10 seconds, you're gonna slowly ramp down the intensity. Really control that tension coming down back to 0. Now we're gonna go into our rails contraction. We're gonna actively engage this tissue, and we're essentially trying to lift and rotate this foot off the floor. You're not gonna get much movement here because you're in your end range, but that's okay. We wanna just make sure that we're contracting that tissue as much as we can. And you're holding that contraction. After your 10 seconds, you're gonna slowly ramp down, relax, and then see if you can get into a deeper range of motion. And that is PAILs and rails for hip external rotation. A couple things to keep in mind. If you have a hard time staying in the 90-90 position, where you're like trying to fight to stay upright, we can modify that. All you need to do, just lean to the side. Then just try to find the stretch from a lower position. Another option is you can use a wedge or a yoga block, and this at least elevates your foot, giving you a deeper stretch so you can feel it in the outside of the hip. Just making sure that you're still going through the cues of tilting that pelvis forward and making sure that you can feel the tissue on stretch on the outside of the hip. And then same principles still apply with the PAILs. You're gonna basically try to make this foot heavy into the yoga block, but being mindful not to let that knee pop up off the floor. If you do notice that your knee starts to come up off the floor during your PAILs, what you can do is use your other hand and just block as you do your PAILs. And then you go into your rails contraction and then try to lift off the floor. Again, being mindful, making sure that you are actually in your true end range. So if I'm out here like this and I'm all the way on the floor, then I can still lift that leg. Not much, because I do still have limitations in my right hip. Shh, don't tell anyone. But if I come up, then I can't actually lift. I've now found my true end range. So you always want to make sure that you're in your end range. We're trying to establish new range and not just train the range that we have control over. So those are some strategies that you can use in order to help improve your hip external rotation.